Well, toothaches are certainly a pain, but they can be taken care of. We want to talk to Dr. Bruce Goeringer from Dallas once again, from Goeringer Family Dentistry. Dr. Goeringer, good to see you again.
Good to see you again, Dave.
Well, you know, toothaches obviously can be a real issue, and I know your #1 piece of advice is if your tooth hurts, get to a dentist immediately.
Yeah, don't wait. Some people come to me, they say, well, it started a month ago, then it went away, and I thought it was going to be away, it would never come back. Well, then they come in and they need something very extensive done, where if they had come in earlier, it would be something very simple. So it's important to get in right away. Don't wait. If you have a toothache, if you're suspicious, come in. If it's nothing or if it's something very simple, we can tell you that, and then you can rest at ease.
And when you come in, you know, it is possible in the case of an extreme toothache, you may need something more significant done.
Well, if you wait long enough and you leave a problem go long enough, it could end up where the decay actually gets into the nerve of the tooth. And then you have two choices. You need either a root canal or extraction. A root canal is very involved and involves a lot of the dentist time, and your time, maybe several visits. Sometimes you can do it in one visit. Many times it's more than one. Of course, an extraction, you lose a tooth. Once that's gone, you can't put it back in. So it's a dire circumstance when you reach the point where you have a toothache and it just doesn't stop. If you're up all night with a toothache, or if it's hurting all day long and it won't go away, you've reached a point where you're going to need something you'd rather not have to do. So it's important, get in right away when it's easy to fix.
But if you act early, you had mentioned that you know, you could actually take care of that problem that very same day. And those of us, and I think it's pretty much everybody who have had a toothache, know it's an issue you want to get taken care of right away.
Sure. And you can keep it simple. One visit. If you get to the problem soon enough, it's fixed, and you put it behind you. Go on with your life and forget about the tooth.
And then, doctor, what happens if infection develops? That can cause some additional complications.
Well, if you have an infection, if you have swelling, if you have drainage from the tooth, a bad taste in your mouth, a lot of times you'll need to take an antibiotic. Of course, either the tooth should be taken out or the root canal started in the meantime, but you may need an antibiotic, you may need some pain medication. Many times, if someone has a problem to begin with, before they go to the dentist, they might try something over the counter. These over-the-counter medications, aspirin, Tylenol, Advil, Aleve, all help. But generally, they'll reduce some of the inflammation, thereby reducing some of the pain. They'll mask the pain, but ultimately the problem is going to come back again, and it'll need to be treated at the dental office before it'll actually go away.
All right, some great information about taking care of toothaches. And Dr. Goeringer, for more information on what to do in the case of a toothache, how can our viewers reach you?
They can reach me by phone number. It's 675-3646 out in Dallas, or my website, which is drgoeringer.com.
All right, great information for Dr. Bruce Goeringer of Goeringer Family Dentistry in Dallas. Thanks so much for being here. We'll see you again next time.
It's a pleasure, Dave.
All right, I'm here.